It's some 35 minutes after 7. My guest is Kojo Aho ACL doctor. He's a pediatrician with the Department of Child Health at the Kolebu Teaching Hospital. We're talking respiratory tract infection in children. Good morning, Doc. Thank you for being here.
Thank you, too.
But it will be appropriate for you to tell us around this time what children are prone to getting in terms of diseases or sicknesses.
Okay, thank you very much again. Around this time, for example, in the southern parts and most parts of the northern part of Ghana, they tend to develop a lot of viral infections. Okay, yes, so that is one of the common things. So you go to the hospital, you notice a lot of children of what we call it cold and catarrh.
Yeah.
Yes, maybe in upper parts of the country, we know what's called a cerebrospinal meningitis. Sometimes there's an outbreak and those things. So these are the things because of the harmttan season and all that. Yes, so
I realized that my son was he was getting the cold, the running nose, but it was very consistent. I mean, it was almost like not going. You treat it and then it comes right back.
Okay.
What happens?
Okay. How old is your child anyway?
He's 3 going on to 4.
Don't worry. Years or month?
Yes.
Okay, good. We like talking according to age and months and all that. Yes, so it's true, especially the child goes to school, isn't it?
Yes.
Yes, wonderful. So as I said, around this time, or normally in children under the age of 5 years, they are prone to infections, especially respiratory tract infection. But it's one of the commonest diseases in children, and one of the things that a mother will take her child to the hospital, and so it's quite common. And most children get prescription for that because of what do you call it? They get a lot of discomfort sometimes that comes with it. Because, for example, children are what we call obligate nasal breathed. What it means that they breathe through the nose all the time. And so anything that obstructs the nostrils, for example, makes them uncomfortable. So one of the common things is cold, and that's it. Around that age, 3-4 years, what's happening is that especially when they go to school, everybody is there. So as I catch my cold and it's going, another person to catch it, and so it runs around. So it will go and it will come. And normally it's been noticed that children can have about 46 cold in a year. But sometimes too, as you're saying, it might be going on for a long time, and it might not be cold per se, it might be different things. It could be allergies, could be, asthma, it could be other things.
When cough sets in and the child is unable to breathe properly, how can the mother tell or the father tell?
Okay, when cough sets in, cough, for example, is a one symptom that can be assigned to many conditions, okay? So you can have a cough which could be just a common cold, as we call it, a common upper respiratory tract infection that everybody develops. Or it could be a sign of a very serious thing, even like cancer, all right? So that is it. You actually would need to know what's really the matter is. The common cold that the children normally have, the child will come from school with runny nose, and then fever. Most of the time it's viral, so the fevers are not that high, and then the cough will set in. The cough will set in depending on the disease, or depending on the microorganism that is causing it, or the germ that is causing it. It might be, as I said, viral. It could be even bacteria, but most of the time it's viral, and so it's, as we say, with medication or without medication, it will go in 7-10 days. But sometimes too, it's muddling down and then develop into even a bacterial infection, and so the child will start having difficulty breathing. Sometimes it could be just a viral infection. So we have a lot of children that would develop what we call bronchiolitis. Bronchiolitis is just viral infection, but it goes into the lungs, and so in that case, the child will have difficulty in breathing. And then those very small infants, for example, when the nostrils are blocked, as I said, they breathe through the nose, and so if they cannot breathe, they will start you have what's called air hunger, and so they'll be breathing very fast because you need to get air into the lungs and all that. Sometimes it could also be that they develop pneumonia, okay, from the same process. Most of the time when the respiratory tract is colonized by the viral infection, it's get rid of the protective surface, and so then the bacterial infection overpowers the body, and then the infection is set to. Because mostly children are immunosuppressed in a way, and so they easily get bacterial infection from that. So they might develop pneumonia through that. Sometimes it's just not because it could be that the child is an asthmatic, and the commonest trigger of asthma is respiratory tract infections. All right, and so the child gets respiratory tract infections, and then the asthma is triggered, and then most of the time when it triggers, they'll breathe in fast. When you say a child breathing fast, one, of course you don't know how to count the respiratory, so you don't know. But the most important thing for the mother or the father is that the child will be breathing fast. Okay, and so you notice that his breathing pattern will increase. Then the child might not be feeding well because then he's not feeling well, so he will not be feeding well. That's very bad, especially the very tiny ones. When the noses are blocked, they cannot breastfeed because you have to breastfeed and breathe through your mouth because your nostrils are blocked. And because you cannot do that, then they have difficulty. So we must see a child who has a common cold, or an infant who has a common cold, and will come to the hospital dehydrated because it's not been able to breastfeed well. So this is how it's happening. So a lot of things can cause, as I said, it could be that the common cold, it could be that pneumonia, it could be that you have developed bronchiolitis, or it could be that even it's an asthmatic.
In my case, I was told my child couldn't breathe out. And it was a bit scary. I was just wondering, why didn't I pick that up?
No, it's possible for you to pick it. The only thing you can pick it up is, as I said, the child is breathing fast, or the child has a fever, it's not doing well, then you have to send the child to the hospital. Not breathing out means that there's some obstruction, especially in the lower parts of the lungs. And so what's happening is that there will be what's called inflammation. The bronchioles, or those trees, as you put it, in the lungs will get blocked, and when they get blocked, it serves as a valve. And so when you breathe in, the air goes in, and as it goes in, we have to breathe out to bring the carbon dioxide out. But because of that valve thing there, when you're going to breathe out, it sort of closes, and so the air does not get out. And that's what sometimes even happens to the asthmatics. So the air cannot get out, and so they cannot breathe out the air, and so you hear them with that wheezing sound in their chest. Yes.
After my experience,
so it could be that the child just might have developed bronchiolitis, and that's common around that time. Okay. Sometimes some people confuse it with asthma.
Okay. So I realized I wasn't the only person.
Yes.
Some of my colleagues also experienced it with their children, and somebody also shared an experience on Facebook. Yes. So we thought, okay, this might be. And in those other examples, you realize that they perhaps went to the hospital too late. Yes. One person's story was that every other hospital was treating the normal cold.
Yes.
And nobody took it further. Is it easy that a doctor would think, oh, the child just has a cold or just a normal cough, and prescribe anything for the child?
I'm not getting a little bit of what you are getting. I'm not getting that's the picture word. But what I get is what I get from it is that probably somebody might have diagnosed the child later on with asthma. Okay, or yes, most of the time that's what happened. What's happened is that, you see, for children, there's sort of, let me say, a thin line between just having a viral reason. What viral reason means that you develop a cold. As I said, most of the infections that those children will get are caused by viruses. You get a viral infection, and then they will wheeze with it. So that's normal. Most children will wheeze once or twice before they are 5 years old. Okay, so that is normal. Then there are other groups that will wheeze, and when they wheeze, it could be that they will wheeze further on after 6 years. Those who are asthmatic. Okay, some too will wheeze throughout from day one. When they wheeze throughout. Some when they wheeze after 6 years, they will wheeze again. So what's happening is that as the child catches cold and go to the hospital, the doctor or the healthcare provider will just see that the child has a cold, is giving what is supposed to be given, and the child gets better. They might listen to the chest, might not have heard anything in the chest. But what could happen is that at one point, the child might start wheezing. And so somebody else will listen and be thinking that, okay, your child is wheezing, so I think it might be having some sort of difficulty in breathing, which could be a bronchiolitis or asthma. Now, if the child is less than 3 years, it's quite difficult for people. Classically, we used to say that, a child after the asthma after 2 years, asthma before 2 years is difficult to diagnose. So most people before 2-3 years, but not actually tell you that your child has asthma, because in that setting there's a lot of connotation if somebody is told that your child has asthma. And then secondly, to as I said, there's a thin line between just a viral wheeze and then asthma, and so most people will not do that, and so you'll be going and coming. And then later on, when the child is 5 years and it comes for wheezing, and somebody will tell you that is wheezing, even though these days we know that children can start with asthma from a very tender age, or the asthma they can debut with asthma from very tender age, depending on the other factors. For example, if your mother is asthmatic, if your father is asthmatic, if you have eczema, okay, if all those things are there, plus the wheezing, as the child has been wheezing, all those things, then you notice that yes, possibly the child has asthma. So that is what. And if you are diagnosed or somebody suspects that you have asthma within the first 3 years, and then what will happen is that they might want to try you on a medication, and then the medication will actually prove that you're asthmatic or not, because most of the time if an asthmatic and you're giving them medication, you will do well for that particular 3 years. Most of the time you have 3 months. Of that 3 months, after 3 months, if the medicine is taken out, you might come back wheezing, and so then the doctor can tell you that, okay, yes, I think your child has asthma. So it is difficult at that age to say that somebody has asthma, because of a lot of viral infection that children develop around that age. So as I said, about 6 times in a year. So you can imagine. So I know that a child can have a cold 6 times in a year, especially when they go to the schools, the preschools and all that. So then you go and come. Then maybe next 2 months you go and come. Next 2 months the child will come again. All right. When they reopen school and they go, within the first few months, every mother is taking the child to the hospital because everybody's catching cold. Okay, the cold per se is not the problem, but the complications that might come of it. That is it. As I said, the cold is viral, so most of the time, viral infection, the body will take care of it. But sometimes they develop complications, i.e., the ear infections. Okay, sometimes man even go on to complicate and even develop meningitis from the ear infection and all that. So these are the things that are the problems. And as I said, if you have a predisposition for asthma, then it will trigger your asthma. So these are some of the issues.
The wheezing and sneezing.
Yes.
What's the difference?
Okay, so sneezing is, as I was listening here, chatting with Roland, I started sneezing, especially because I had the powder on my face. I react to powders and the dust and all those things. So immediately I come to that contact, I will sneeze. So sneezing is just from your nose. That's no sign that you did. That is sneezing. Wheezing is a noise. It's a whistling noise that comes from your chest. Okay, it comes from your chest. And anytime somebody is wheezing, you notice that the chest will go in. The muscles between the ribs will be going in, and the child's respiratory efforts will increase, will be breathing very fast, and you hear that noise like a whistling sound in the chest. So the difference between the sneeze. Sneezing is normal thing we do. We sneeze straight from the noses.
So if a child is sneezing a lot,
and then the other thing too is that some people who have asthma or have allergies will be sneezing most of the time, especially in the mornings. They'll be sneezing. So that's what. So you notice that some children will be sneezing all the time. Anytime, every time they are sneezing, anytime it looks like they got cold. It might not be just a viral cold. It could be that they are allergies. When you have what is called the allergic match, okay? The allergic match, what it means is that it starts actually most of the time with what do you call it, the skin rash, the eczema and all that. It goes on to the allergic rhinitis. So allergic rhinitis, sometimes somebody might confuse with common cold, okay? And then it will go on to develop asthma. So it's a match, okay?
So if your child, is there a test? We're getting into the asthma zone now. Is there a certain test that you can do to determine if your child actually has asthma or not?
So for you, anybody to tell you that you have asthma, there are things that might happen, okay? One, the child should have signs that there's some obstruction in the respiratory tract. That is one. Two, if I detect that as an obstruction, as you said, your child was told that he wasn't able to breathe out. That's not obstruction. So I was saying that some inflammation, something blocks the airways, and then the child cannot breathe out because whenever you go to breathe out, expire the air, it blocks the airway. So that's the obstruction. 2, if I give you the medication or give the child a medication, that's most of the time the salbutamol, the one, the Ventolin, that's people know it popularly as Ventolin. If I give the child Ventolin, either I nebulize or I give it to inhale, the child should get better. That is it. Okay. So these are some of the things that will tell you that the child is doing well. And then when I test, there are tests that we can do, what we call the spirometry or the peak flow spirometry. If I do that, the child should improve on that. So these are the things that you do. Secondly, if I know that there's a family history of allergies or asthma, and the child comes with those signs of flashing notices, and I can tell that child is asthmatic. The other things that we can do are there, but sometimes it's not necessary. You can, if the child come and doesn't have the symptoms, that doesn't have the symptoms, and you suspect asthma, we can do other tests that can tell us that the child has asthma. Okay, those tests are quite sometimes difficult to do because you have to provoke the asthma to occur, and sometimes it's not necessary. So most of the time it's clinical, as all those things are put across, and then spirometry or do a peak flow rate. So this are the difference. So in most hospitals, when you go, nobody is going to conduct a test of that sort. It is when maybe it becomes difficult, you have to differentiate between asthma and other things, because so many other things too can mask asthma. Okay, and so you have to then determine whether the child has asthma or not. For example, people have a problem of their vocal cord, might behave as if they are asthmatic. Some people might have some tumors or even tuberculosis, sometimes can behave as asthma. People who have what you call a gastroesophageal reflux, so the food content comes up from the throat and gets into the airways, and also might even behave like asthmatic. Okay, people who have allergies, okay, early in the morning, you notice them coughing, okay, coughing, then they may be asthmatic. And let me put in here that sometimes some people with asthma will just cough. They just cough alone. So he or she might not be wheezing or might not be having difficulty in breathing, but just cough. And most of the time, the cough is in the night. So, for example, if you want to tell that somebody has asthma, one important question I have is does the person cough in the night? Most of the time, they will cough in the night. There are two ways of coughing. There are two things that actually can cause that one. Persistent cough in the night. One, if you have what's called the allergic rhinitis, okay, the obstruction over there, most of the time there's what is called the postnasal drip. Some fluid falls behind your throat into your larynx where the cough receptors are, and so the person will start coughing then. The other thing is that you're an asthmatic, so you are coughing around that time. But even if you have allergic rhinitis, it will notice that allergic rhinitis, if you don't treat it well and you have asthma, it will not get controlled. So you have to also treat it very well.
Sure.
So you need somebody who can actually assess you completely in that sense, and understand that yes, a child is a child, and there's a possibility of developing asthma, and also there's a possibility that the condition might not be asthma, it may be different, and so you have to then differentiate between the two. Yes.
Okay. If you've got a question on this conversation, you can please send me a quick WhatsApp on 0560 800,000 0560 800,000. Are there special foods that children can take around this time to prevent catching the cold, the cough, and the runny nose?
Okay, so catching cold, as I said, is most of the time is viral infection, all right? And so, yes, it will happen. I mean, children will develop cold here and there. Of course, we know that you take some fruit and all that. It's good for you. But most importantly, the child should be healthy. The child should should get what we call the 3 square meat plus with the snacks and all the other things, and that is most important. The child should eat well, because what is noticed that if the child is well built, he or she does not suffer infections. Okay, because the body will protect itself from the viral code. That's I said, viral infections normally they don't need treatment per se. They will go. The body will develop antibodies, and the antibodies will fight them.
Okay. So would you also recommend that I keep my child at home?
Your child is, for example, your child is 3 to 4 years.
Yeah.
Not necessarily. In fact, it's maybe notice that those who go to school, okay, early, tend not to develop asthma, okay, because of the infection that they come into it. I mean, there are theories that have noticed that some people who get infection in early ages, for example, those who live in the villages, they tend not to get asthma, and those who live in the cities, clean environments and all that, tend to get asthma because the body in that environment doesn't have anything to fight against, and so the body sort of fight against itself. So what we call the hygiene hypothesis. And so the child in a very nice environment, an East Legon child, what do you call it, Trasaco child, and all the children might not be having the pneumonia and infections that maybe my village boy will be having, but then they'll be coming with allergies and asthma and all that because the body actually is fighting against itself, develop things that it will fight against itself. So they tend to get the asthma and all that. So if you attend to children of that category, you notice that most of the time they come with these conditions, not necessarily the other one that's going to say those with the those in the lower socioeconomic background will come with. So yes, your child has to go to school because there are a lot of things that you get from school, a lot of benefits you get from school. Cold will not kill the child. Okay.
Cold will not kill the child.
Not at
That's
all.
reassuring.
Will not kill the child. You have to then be proactive. You think the child has cold. You don't think that he's well. Take the child to doctor. Doctor will advise you as what to do. But don't leave the child. But sometimes people say that the child is 1 year and the child is going to school. That's one we have to discuss that one in another time. But a 4-year-old child is supposed to be in school.
Yeah, okay. So in wrapping up, we just want to read some of your messages. My friend MD Kwesi Mai in Akosombo, he's always watching us. He says, good morning. My morning couldn't have started any better. I have learned a lot from this discussion. Thanks a lot for the good content you and your team always strive to bring to us, your viewers. AM Sure, educative, informative, and entertaining. Grateful. Thank you very much. Somebody sent me a message and says, I've been sneezing a lot, but I don't know if it's a child or if it's an adult. Okay. This is children only, or if it's an adult?
I can answer. Okay, so if you sneezing a lot, there's a possibility that you have allergic rhinitis. So you see a doctor, they will ask you some few questions, they will examine you, and then they will give you the right thing to take, and you might get better. And they also look at your environment, what actually causes you to sneeze. Maybe the thing is just around you.
Okay. Yes. Patience from Tumu says, I always cough at night, but I'm not asthmatic.
Well, I'm not here to diagnose, do an online diagnosis or what the television diagnosis. But what I would say is that if you cough at night, as I said, some people their only symptom of asthma is just cough. So we should go to the hospital and then he'll be assessed. And if they think it's asthma, he'll be treated. They will do 1 or 2 tests, as I said, the spirometry and all those things. If he fails the test, they might tell her that it's asthmatic. So she should go to the hospital.
Mabel is asking, how often does a child get asthma attacks? How do you draw the line between an allergic cough and an asthmatic cough?
Yes, so that's what I was saying. There's a thin line between the allergic cough on asthma per se, because as I said, there's a match from having developed eczema from food and also from early infancy to developing allergic rhinitis and then asthma. Some people, as I said, their only symptom of asthma is cough. Some people too, before they develop difficulty in breathing, they will cough. Okay, so that is this. So if your child has a persistent cough, of course, it could be asthma, but also it could be different. It could be tuberculosis. Okay, and so the most important thing, I took the child to the hospital, and if, for example, if it's tuberculosis, they might not be thriving, they might not be growing well, and all those things. There might be somebody in the environment who, especially an adult, who is also coughing around. So a doctor will have to assess. But if the child who is thriving well, he's well brought and all that, and is coughing frequently, it could be an asthma. Sometimes, just putting the child on medication, you will notice that the child will get better. And so in that sense, you can say, okay, your child is an asthmatic. So as I said, some people, the only problem they have with their asthma is just the cough. So if you manage the cough, you get better.
That's it.
And then managing cough is not cough syrup. It is not cough syrup.
Okay, what is it then?
It's not cough syrup because, first of all, as I said, you have to get to the bottom of the cough. What is really causing the cough? There are a lot of controversies about cough syrup and all that. I'm not coming here to come and spoil people's business anyway, so I will not talk on that. But we are fond of asking doctors to give our children or even ourselves cough syrup. If you go to the doctor tells you that your child does not need cough syrup, please understand the doctor. And this is what I will say about that one.
Okay.
Please understand the doctor. If the doctor tells you that your child does not need cough syrup, just understand. Because cough syrup, it is not a treatment for. It's not a treatment for cough. Any cough has an underlying condition. And so the underlying condition must be treated for the cough to go.
Okay.
So that's the most important thing to be done.
Okay.
So that
I
that
get
is
you.
it.
All right. This one says, good morning. My son is very active, strong, and healthy. However, he has difficulty in breathing and coughs a lot in the night. Could he be asthmatic?
Yes, it's a possibility. As I say, everything's a possibility here. It could be asthmatic, especially in this child that might be wheezing whenever they are playing. So that's some kids, whenever they are playing, you notice that they are panting. Of course, it could be an asthmatic. It could be that it has a heart condition. But most of the time, it could be an asthmatic. So what is called exercise-induced asthma. Okay, exercise-induced asthma or exercise-induced bronchospasms. So that child might be asthmatic. So if the doctor diagnoses, goes to the doctor of this symptom, anytime a child is playing, he's panting, they will do 1 or 2 tests, or they will even do a trial of medication and use the child is asthmatic. As I said, cough and asthma sometimes they are the same thing. So the possibility, but as I said, there are a lot of causes for cough. So most importantly, go to the doctor. Doctor will align a lot of conditions and then rule them out. Take one out and tell them, okay, I think this one is what is causing your cough.
Sure.
So cough alone cannot be based on and say, okay, so take this medication. They always have to find the underlying condition.
Okay.
Yes.
I promise we're not going to go beyond 8. I'm getting a lot of messages, so let me just wrap up with it.
You can take 5 minutes now.
This one says, Doctor, I was diagnosed with asthma for the past 5 years now, but I get tired easily. Even sometimes walking a distance is normal.
Okay, so how we don't know the age of the patient or the person. That's one. 2, if the person is not getting better or is not get tired easily, it could be that 1, he is not controlled. If he's been diagnosed, doctor diagnosed asthma, because we have what you call doctor. If you say doctor diagnosed asthma, it means that the doctor has put 1 or 2 together and say that you are asthmatic. So it could be that the person is not well controlled. So he might not be taking the medication or might not have been put on the appropriate medication. And so you have to see the doctor or see another seek a second opinion, and then he'll be given maybe the right thing to do.
Okay.
However, it could be that there's another condition, because in health we tell you that most people who walk to hospital might have 1 or 2 condition or 2 or 3 conditions at a go. You have to go to the doctor and then it will be assessed and then right will be done for the person.
Benjamin from Mankasim says, can this respiratory tract infection cause bad breath?
Yes. Yes, it's possible, especially when
even in children.
Yes. Most mothers will come and say, my child has a cold, and then I notice that his breath is bad. Yes, sometimes have what's called the sinusitis, okay, and then it can develop. It can have bad breath, and whenever you are treated, they get better. Yes, mothers come and complain of that. Yes.
Paul Yeluzi is from Techman. He says the difference between is it bronchitis and asthma. What's the difference he's asking?
Okay, so bronchitis is inflammation of the bronchus. Okay, that is what can be caused by any pathogen, being a viral, bacterial, fungal, parasite. Any of these can cause bronchitis. And in adults, it could be a chronic condition. All right, and so it has been managed. Sometimes, some of these people will develop what's called a chronic obstructive pulmonary disease, which sometimes it's difficult to differentiate between that one and bronchitis. And so they might have to manage, and sometimes manage them as asthmatic. as asthmatic are managed, especially in adults. Yes. In children, bronchitis, most of the time we don't use bronchitis, we use the bronchiolitis and that's what I'm telling about. And they wheeze the same way as asthmatic will wheeze. And so, as I said, in children, for sometimes it's difficult to differentiate between a bronchiolitis and or what's called a viral wheeze and then asthma at a point sometimes. Yes.
All right. We have to wrap up. Perhaps I should have just put this on Facebook and ask you to, put your questions together because we're getting a lot. Jojo in Bimbala, for instance, says, good morning. I suffer several years now from runny nose, sneezing and irritation and the nose and tongue and sometimes cough and also sore throat in the mouth. What should I do, doctor? I know the doctor will say, see a doctor.
Yes,
but this one says,
yes.
I usually manage my child's cough and sneezing with cetirizine syrup just to avert the occurrence of asthma attack. Is it good?
Yes, so I like any question on a child, so I'll answer that one. One, as I said, the allergic match. So start from the eczema, start from the allergic rhinitis, and then goes on with the asthma. And so, as I said, if you don't manage your allergic rhinitis well, you come with asthma attack most of the time.
Okay.
So it needs to be managed well. However, it is not just using cetirizine. These days we use what we call the steroid. Okay, steroid. So you go to hospital and they'll give what we call the nasal spray or nasal steroid, and then they'll use that one. You'll be treated for some time, the child will get better. So yes, even though cetirizine will give some relief, she's supposed to see a doctor. You'll be given maybe nasal steroids, but depending on the age of the child.
Okay. So this is what I'm going to do. You can keep the questions coming through. I'm going to compile and I'll go to the doctor's office if he allows me, and then we can answer a lot more of your questions. For now, though, that will be it for my banner, Dr. Kojo Aho Esel. I am absolutely grateful for your time. Thank you so much. He's a pediatrician with the Department of Child Health with the Kolebu Teaching Hospital. Up next, we have Uncle White in here. Stay with us before AM Talk.
Okay, so let me take a